Hello everyone. Before Vidya and Dr. Rupali joins in, I'll just give a brief intro of what we were talking about. So today's topic of discussion is gestational diabetes, and we have Dr. Rupali Satija with us. She is a consultant physician and a diabetologist. She's currently practicing in Mumbai, and this is the third time we are connecting to this session due to some technical issues. So just hold on and yeah. We did start off with a few questions, but we will take up those questions again because the previous session, I guess, I will not be able to share with you all. Hi, Dr. Rupali. Just hold on a
Yes.
minute. I'm trying to get in Vidya, and then we can
Yeah, sure.
continue.
Yeah, sure.
Let us start with our first question because the previous session I may not be able to get it from the archive
Okay,
because it
okay,
was
okay.
interrupted. Okay, so I'll quickly start off
No
with
issue.
the first question to you. So sorry for all this
It's okay.
inconvenience.
It's okay.
Yeah. So the first question that we had was that how is gestational diabetes different from the other kinds of diabetes that we have, that is type 1 and type 2 diabetes?
Yes. Okay. So like I said earlier, so basically what you have to understand is that diabetes is just a rise of blood sugar in the body, which the body is not being able to compensate. So we have a hormone called insulin, which helps in decreasing our blood sugar levels. So if we don't have that enough in our body, the blood sugar will rise, which will ultimately is called diabetes, right? So it is different how in gestational, that gestational means being in the pregnant state, right? So if you are pregnant and you get diabetes, it is termed as gestational diabetes. If you have been pregnant prior to getting diabetes, like diabetes you had and then you got pregnant, then it is not called as gestational diabetes. If for the first time you have been diagnosed to have diabetes during the pregnancy, then we term it as gestational. I hope I'm clear to everybody. Yeah.
Yes,
Yeah.
apart from the time when the woman is diagnosed with diabetes, there's no other difference between existing diabetes, like say type 1, type 2, and
So,
gestational.
yeah. So the difference is that what happens is that gestational diabetes, once you are again post-delivery status, it might recur to you, and then the people get type 2 diabetes. So many people get diabetes for lifelong period once they have delivered as well. So in that case, they get type 2 diabetes. But it is not called gestational diabetes at that time. So that is the difference. Yeah.
Okay. Is it genetic, Dr. Rupali?
Yeah. So lot of studies are going on about it. So as such, there is no conclusive journal or conclusive study that says that yes, it is genetic, and definitely if you have it, you will be passing on to your children as well. But it has been seen that if you had any parent or sibling or any close blood relative in the family who has diabetes, there are chances that you will get diabetes in your pregnancy. So it is not 100%, it is just a complex cycle of your lifestyle plus your genes combined together.
Okay.
Okay. And what are the symptoms to look out for during pregnancy?
So even in pregnancy or non-pregnancy, for all the diabetics, many are undiagnosed because they do not have any symptoms. So they go on with their lives until and unless the levels rise so high that eventually they start feeling something. Still, many people do complain of increased thirst, there will be recurrent urinary infections. Okay, then there is increased hunger. Even if they've eaten, they feel like they want to eat more. So the signs are basically very general. So that's why it gets missed. So it's important that if you are planning to get pregnant or you have just known that you are pregnant, you get yourself checked once. It is safe to do that.
Okay.
Just one thing, Dr. Rupali, like during the once the woman conceives and she's pregnant and she reaches out to a gynecologist, then
Hmm.
this is one of compulsory checks that are being done, or is it something that is not normally done?
These days, yes, if you go to metropolitan cities or you go to corporate hospitals, they are definitely doing it, irrespective of your status. But if you don't have any history of diabetes in your family, you are thin built, your diet is fine, then you can avoid the test as well. But nowadays we are doing it because many go asymptomatic. That's why.
Okay. And
Yeah.
when exactly this test needs to be done? What time? Like how many weeks after conception?
Yeah. So basically, what we do is many people do come at later stages in the pregnancy. They are already 10, 12 weeks pregnant. So either if the patient is overweight or obese or she has a history, we do it there and then itself when she comes, or it is done from 24 to 28 weeks of period. It is done. They give you some glucose to take and then they'll keep on checking your sugar at different intervals. Okay.
Can gestational diabetes have an effect on baby as well?
Okay, so as such, there have been no studies that it causes deformities in the babies because it comes at a later part in the pregnancy. Already the organs are formed, so that is a good thing. But if the glucose is high in the body, that whole entire glucose is going to the baby through the placenta, right? So which leads to more fat accumulation in the baby. So those babies will be big. So it becomes difficult to deliver those babies in later pregnancy, right? So what happens is that chances of cesarean section increases, and if at all, if you are in periphery, they try to do normal delivery, the baby can have trauma to the shoulders while coming out because they are big babies. So that is where the problem occurs.
Okay.
Yeah.
And how can we follow a healthy lifestyle to prevent gestational diabetes?
So a healthy lifestyle should start before you get pregnant. So yes, sometimes it can be accidental pregnancy. That is a different matter. But if you are planning to get pregnant, you should know that, okay, you have to take care of your health later on. So you have to be in a certain weight. You have to follow a certain lifestyle, which includes diet and exercise as well. So that is the only way that we can prevent getting it. So for all those females who are overweight before getting pregnant only, they should try reduce, because during pregnancy you cannot lose weight. You cannot focus on losing weight during that time. So be in a particular weight before itself so that you don't have to worry about it. Start following a regular exercise pattern which you can follow during the entire pregnancy. Basic exercises you can do regularly. Aerobic exercises will help definitely during the pregnancy as well. So keep on doing that. That will prevent in getting accumulation of all the sugar levels. So it will help you.
Okay. Okay. We actually covered one part of answer for the next question, but still I want to ask this.
Yeah,
So
yeah.
what are the risks involved during labor because of gestational diabetes?
Yeah. So like I said, because those babies are bigger in size, one is that the baby size will also be bigger. Other is that whatever water is accumulated in around the baby, that also becomes more. It is called as polyhydramnios. So there is more water accumulation. So those pregnancies don't go till 9 months. There's a risk of getting premature deliveries as well, because the size will be more, so baby cannot go through 9 months. So then you have to take medications prior for lung maturation of the baby. So it is not healthy for the baby. One thing is that. Then yes, it increases the risk of getting cesarean sections as well. And plus, once the baby is delivered, because it has taken so much glucose inside, it produces more insulin, the baby himself or herself, which leads to having a risk of decreased sugar in the baby once the baby is delivered. So the baby is at a risk of going to the ICUs post-delivery. So one thing is that as well. So it is very important that you take care of your diet and exercise from the very beginning so that you don't have to go through all this.
Once yeah, thanks for that, Dr. Rupali. Like say once the woman has been diagnosed with gestational diabetes,
Yes.
what like apart from medicine, of course, like she will have her doctor advise her regarding the diet and medications and everything. But then from your end, is there any advice that you would like to give to the woman? What are the
So,
things that she should be avoiding or eating, or how like it's mainly about now about balancing it out, right? Like
Yeah,
after you
so
have.
you should know that first of all you should know how many calories do you have to take, because in India I've seen the concept is that if you are giving birth to a baby you have to eat for two people, which is a very wrong concept. It is not two people, it is just one person eating. Yes, you are giving energy to the, but you don't need to eat entire two people meal. So people end up eating more because they want a healthy baby, which is not right. Plus, if you are overweight before only getting pregnant, you don't need those many calories, because in the end you cannot even walk when you come to 7-8 months. So how will you burn those calories? So first is, from if you cannot do it by yourself, go to a dietitian who will tell you how much calories you have to put. From those calories, only 40 to 50% of carbohydrates is enough on your in your regular diet. So you should eat only those foods which give only 40 to 50% of carbs. More than that is not required. Okay, so these things if you take care of, ultimately you won't get those many sugars inside. So it will be easy to digest it, right? Then the next thing, yes, if you have diabetes during the pregnancy, you will be getting medications or insulin, but don't be scared that okay, you are getting medications and insulin, so will you be have to take it lifelong? No, it's not like that. It is required for that period. That's why the doctor is giving it. It's okay. It is safe. It's fine. So don't get scared that okay, I'm eating medications. Will it harm the baby or not? Or whatever goes into a mother's mind. It is natural, but you should listen to what the doctor is saying. It is required for that time to control the sugar levels. Once the process is done, it will be normal again.
Okay.
So basically, there will be a lot of diet restrictions for the women who are diagnosed with gestational diabetes during the entire pregnancy, right? So they have to monitor each and everything and keep checking their sugar levels and other things like that, right? Yeah,
Yes,
I'm
because
one of
yeah,
my
yeah.
friends was diagnosed with gestational diabetes, and she actually had to keep track of every single thing that she's eating. Like everything actually. It's not only about rice, even chapati or other things. She had to keep a track of her sugar before eating and after eating. So
Yes,
is
yes.
this really required during the entire pregnancy?
So it depends from individual to individual. If your sugars are sky high, yes, regular monitoring will be required, because we cannot afford the sugar levels to go very high. But if it is in normal range with one tablet or maybe just by diet, then we are okay with it. The aim is just that till she reaches 8 months or 9 months, baby is mature, the sugar level should not fluctuate that much that it should harm the baby. That is the only aim. So it depends from case to case.
Okay.
Yeah, just
Hmm.
as you said, there's one question from one of the viewer. I'll read it out to you and you can answer it, Dr. Rupali.
Yes, yeah,
So
sure.
it's from Nandini. My after dinner level alone ranges between 140 to 155. Other meals are normal between 120 and 135. Do I need to take a tablet? That's what she's trying to ask.
Okay, so hi, but I wanted to know, so there's basically a test called HbA1c. So that is the average of sugar that you have accumulated in your body. So that will give a better idea as to how much sugar is there. And plus, you don't need to keep on checking your sugar levels post meal every time. You can just do one sugar level in your fasting and 1 2 hours after meal. So we'll get an idea what your ranges are. So if that is high, then yes, the doctor might prescribe a medication. If it is just borderline high, he or she will just tell you to go with the diet.
Okay.
Yeah.
Okay. Thank you, Dr. Rupali.
And can gestational diabetes continue through postpartum too, during the postpartum period?
So many people, what I have seen, yes, around there are 30 to 40% of women who do get diabetes lifelong once they have delivered in gestational diabetes state. But it is not confirmatory that you will get it. Yes, again, diet and exercise, I cannot emphasize it more because it definitely helps. So you have to keep a regular check with your doctor once you've delivered. Initially, the meetings will be more. Once the levels come in range, they might tell you to just keep a check yearly or so. If it is in range, you don't need to do anything about it. If it is continuously coming high, then yes, you have got diabetes, so you will have to take medications for it.
Okay.
Okay.
Yeah.
And that is type 2 diabetes.
That is type 2 diabetes, yes. Basically, it is combination of your genes and lifestyle. So that is type 2.
Okay.
Okay.
Yeah.
And gestational diabetes, any woman can get, right? It's not only who has genetic.
No, not just genetic. There are combination of things. So African Americans genes, they do get a lot of gestational diabetes. If you are obese or overweight, you are at a risk of getting diabetes. The females who have PCOD, because it is again metabolic disease, so they do get diabetes during pregnancy. It is not 100% that you get it, but there's a chance of getting it. Some studies do say that if you are delivering above 30 years of age, if the mother is above 30 years of age, there's a risk of getting it. So again, it's a combination of things. So it's not sure shot that you will definitely get it if you are above 30, but there is a risk.
What about IVF, Dr. Rupali? Does that have any
I
role?
was about to ask that.
Okay.
Sorry, yeah.
Does that play a role in are there any studies that say that there is a more probability of a person getting pregnant through IVF?
No, there are no studies as such, but yes, IVF again, mostly the females who have to undergo IVF are the ones who are above 30 years of age. So that is one of the risk factors that's already there. So it's a chance that during that you got it, but it's not related to IVF.
Okay.
No, it is not that if you are going through IVF pregnancy, you will get gestational diabetes. It is not like that.
Okay.
Okay. And a woman who has gestational diabetes, is she prone to some other ailments?
No,
Like
as such,
no.
no. But yes, if you are getting diabetes, you have to understand that diabetes is a metabolic disorder, right? So it affects your entire body. So it will have effect on your eyes, your heart, your kidneys, your nerves. So eventually, whole of the body gets involved. So there is no particular disease that you will get, but a lot of your organs get affected through it.
Okay.
So that's why even if you have been diagnosed, don't worry, just work on it. The aim is to keep the levels in normal. It is not that if you've gotten diabetes, you should be scared that I've got a lifelong disease. It's not like that. You can still work on it.
Okay.
Yeah.
So it is reversible.
It is reversible. Like I said, only 30 to 40% of women, they do get it lifelong. Many do recover back. No, even you can see that person gets in one pregnancy, but during her second pregnancy, she does not get gestational diabetes. That also can happen. It is not compulsory that if she has gestational diabetes in one pregnancy, she'll get it in her second pregnancy as well.
Okay.
Yeah.
Okay. Yeah, I have last question actually
Yes,
from my
please.
end. Does
Yes.
does only does the medication need to be only medicine, or even lifestyle changes are enough?
So yes, so again, how much is your average glucose in the body? That will give an idea as to how we are going about it. Lifestyle will be there. First step is lifestyle only. Along with it, if the sugar levels are very high, they will give you medications. If it is more high, they might have to give you insulin for a while as well, because lot of medications we cannot give in pregnancy. So insulin is the safest option there. So it depends again from person to person what your sugar levels are, and then lifestyle is going to be there with or without medication.
Right. And what about insulin, Dr. Rupali?
So insulin, many people are very scared of insulin. They feel that once they are on insulin, lifelong they have to take insulin. Repeatedly people come to me that they don't want to take insulin and they are okay with medications because they are scared of those injections. But it's okay because insulin really helps in decreasing the blood sugar levels very quickly. It works very nicely. Only thing is you have to keep a check a bit, which is fine. Everybody can do it. So insulin again depends. If the levels are very high, you will be getting insulin for all of your meals. The 3 main meals that you take, you will be getting it. If it is manageable range, they might give you only once in the night or morning, which are the long action ones, which will work throughout the day. So it depends again on what the levels are. So that is how we will judge how to go about it. And if the levels have come to normal or near normal, they might shift you from insulin to medication as well. So it's not that if once you are on insulin, you have to continue it throughout your pregnancy or throughout your life. It's not like that.
Okay.
Yeah.
And since it is a metabolic disorder,
Yeah.
and we can have overweight babies. So will it affect the metabolism of baby as well, like eyesight
Yes,
and the organs?
not the eyesight, but yes, the babies are at risk of getting obesity later in their life, and plus they are even at risk of getting diabetes, type 2 diabetes later in their life. They will be at risk of it. So even if you have kids and you've had this, you can work on their lifestyle as well from the beginning itself, so they don't turn out to be obese kids, because they will have to take care lifelong.
Okay.
Yeah.
Okay.
Hmm?
Yeah. I think we have covered all the questions. So as we wanted to. And Nilufer, you have any questions?
No. Yeah, you covered it almost. You covered almost everything, Vidya. Yeah, I don't have any more questions. I can actually see there are 2, 3 like people who have asked questions, but I'm not able to
Yes.
get them. So maybe
Okay.
I can I'll try to get them after our session, and I can forward them to you, Dr. Rupali.
Sure. I would
If you
love to answer
see
any of the questions.
yeah, Vidya, if you are able to see them, you can read out. I'm not able to get them.
Even I'm not able to actually. I'm scrolling.
Okay, I'll try to get them, post the session, and I can send it.
Yeah. Sure.
Can forward
I do reply
it to
back. Yeah.
someone. Yeah. Okay. Thank you so much,
Thank you.
Dr.
Thank you
Rupali.
so much
For
for this.
a lovely
Okay,
Yeah.
session.
one question is here. Sorry. How much one minute. How much sugar level is considered as gestational diabetes?
Okay, yeah. So thank you for the question. So what happens is that when you will be going to do the test for the sugar levels, they'll give you some sachet of sugar to drink, right? And then they will check your sugar levels first on empty stomach, and then 1 hour, and then after 2 hours of giving that sachet. So if your fasting is above 90 milligrams per deciliter, so it is considered as having impaired glucose, right? And if it is, if they check after 1 hour and it comes to about more than 180 or so, then that means that you are having diabetes. And then again, they will be checking it after 2 hours as well. So it depends upon what time they are checking. So every time has its own value.
Okay.
Hmm?
Thank you so much, Dr. Rupali.
Thank you so
Thank you
much.
so much for your time. Yeah.
Yeah, I'm
Yes, thank you
sorry
so
for
much for doing this.
we had
No,
so many drops in the
it's
I'm sorry for that.
fine.
It
It's
happens,
okay.
sometimes we really don't have
Yeah.
any control over it.
No, it's okay. It's a nice topic actually. A lot of young women are coming with this issue, so it's really good if they'll get some awareness.
Thank you so
It's a
Yeah,
much.
good
definitely. Thank you.
initiative that you guys are
Thank
taking. It's going to help a lot of pregnant ladies.
thank you,
Yeah,
for being with us
Yeah.
and talking about this topic.
yeah.
Without you, we would have definitely not been able to answer these all questions. It was
No,
lovely having you. Thank you
no,
so
the
much.
pleasure is all mine.
Yes.
Thank you guys.
Thank you.
Thank you.
Thank
Yeah,
you everyone for
chalo.
joining us.
Take care.
Yeah.
Thank you everybody for
Yeah.
joining. Yeah,
Yeah.
bye.
Bye.